In the name of God, greetings and thanks to the organizers of this Congress. I'm Kausar Mirai Mohammadi, Master Student in Midwifery Counseling at the Mazandar University of Medical Sciences in Iran. I'm proud to have participated in this valuable Congress. I'm presenting you an article with the title of A Review of Various Psychological and Non-Pharmacological Interventions at High-Risk Pregnancies, Miscarriage and Stillbirth, a narrative review. The aim of this study is a review of the evidence concerning the type of psychological and non-pharmacological interventions to prevent or reduce complications in women undergoing miscarriage and stillbirth. The search in this comprehensive narrative review was conducted in electronic databases such as the Cochrane Library, Scopus, PubMed, Web of Science, TRIP database, and SciD. After the screening, 23 articles were selected. Evidence was presented in two general categories, which includes psychological interventions based on counseling and education, contains 1 systematic review, 5 randomized control trial, 2 experimental, and 1 prospective study. Also, variables such as anxiety, grief, depression, and contraception use were evaluated. And psychological interventions based on therapy contains 2 systematic review, 6 randomized control trial, 3 quasi-experimental, 2 single-case experimental, and 1 mixed method study. Interventions include cognitive behavioral therapy, mindfulness, hypnosis, interpersonal psychotherapy, supportive psychotherapy, group therapy, and yoga. Variables such as worry, grief, anxiety, depression, distress, post-traumatic stress, and stigma were examined. Interventions in this group, especially internet-based interventions, were effective in most cases. Despite the different design of interventions, the results showed the effectiveness of psychological and non-pharmacological interventions in most cases. But judging the definite effects of interventions require further research and larger sample size. It was reported that psychotherapy-based interventions were effective in post-abortion grief treatment, especially in long-term grief. Mindfulness intervention in improving mental health, and support group intervention in improving physical health after stillbirth. Thank you for taking time to present this.